I think global health is an inherently interdisciplinary topic and a very broad topic, and it can encompass human health, human healthcare disparities within nations and between nations. It very obviously encompasses human disease and spread of infectious disease.
Global health to me really is looking at all the issues that we as a country, as a world are grappling with that relate to people's well-being, their health. It can be as simple as what's happening locally in terms of people being able to sort of keep a job given their poor health, the link between people's rates of poverty and health. I mean, there's a number of issues that I think really relate very much to what we do in economics as well as what we do in terms of health.
So in the Global Health Cluster, we're really interested in answering 3 questions. The first is a very basic question, at least on the surface, and that's defining what is global health. But we really want to broaden that definition or that understanding of global health to go beyond just physical health, but to also consider things like mental health, spiritual health, more of a holistic well-being. What does health look like for that individual? After we address that question, we're interested in what contributes to health. So what are different, maybe socioeconomic factors that contribute to health? What are different things that people encounter in their everyday life, like stress, that also shapes their health? How do things like gender and the location where you were born, your family systems, how do those things impact your health? So we're looking at all sorts of variables that have an impact on health. Then the third question that we're trying to answer is how do healthcare policy, healthcare reforms, how do those things shape health? And we're looking at it both here in the United States, but we also want to get a more global picture, so comparing it to countries across the world.
Well, that's the question, that global health is being defined in many different ways. Not everybody comes with the same definition of global health. So we are simply trying to answer how do we in the United States define health, and how do other countries define health? How do we approach health care in this country? How do other countries approach health care? And then what are some of the factors that intervene in health outcomes in our country and in other countries, because it's very different depending on, on where you are.
I think what most Germans would be surprised about, learning about America, how few people are actually insured, how many children are entirely without health care or preventive care, how often the emergency room is the first contact with a medical professional, and the high cost that is associated with that. I think there are 2 images that are clashing that Germans might have about American healthcare. One is the Mayo Clinic and the kind of top of the line, cutting edge research related to cancer care, for example. And the other one is the lack of healthcare for the general population. That seems to be unusual in a developed, very rich country like the US.
Pre-med students would certainly find a very good home in global health, but I don't think it should be limited to that group. I think there's a lot of other students who are going to be able to offer a lot to this cluster. So for example, my econ students, a lot of them are very interested in these issues, and they find ways of bringing in data and other types of techniques that we do as economists to help answer some of the big questions that are going on in global health.
I think the students that typically are interested in global health are students who maybe want to go pre-med or have a very strong background in the natural sciences, and that's fine. I'm sure they will get a lot from our cluster and enjoy it. But a message that we're trying to deliver is it's not just for those students. We really want any student who is interested in health more broadly defined, and we want different perspectives, not just people who necessarily bring the medical model of health in, which is an important model and one that we value, but we want people who bring different understandings of health. So anybody who has an interest in health, broadly defined, we would love to be a part of the conversations that are happening in our cluster.